most of what I want to kind of inform you about is intellectual disabilities, or IDs. First off, people first language. We're not going to call these people retards. Mental retardation is a term that has been fully officially changed now and should be out of your vocabulary. These individuals are said to have intellectual disability. They're individuals first, and their disability does not define them. These are individuals who have IQ scores about less than 70 and poor adaptive behaviors or life skills. So there's kind of a two-part thing here. For instance, in the distinction I want to make is that you might have a child who has an IQ score less than 70, but they're normal in their behaviors and life skills at the time. Or you might have someone, for instance, in a coma who isn't able to show behaviors or adaptive skills, but has an IQ greater than 70. So we can't classify either a child or a person in a coma as having an intellectual disability. That doesn't fit right? So there tends to need to be both components. So you might be wondering what does it mean to have an adaptive behavior or life skill? Different examples of that might be things like being able to balance a checkbook, being able to read a bus schedule, get where you need to go, being able to maintain personal hygiene, remembering to shower, brush your teeth, that type of thing, being able to interact with others socially. So this tends to affect about 1 to 3% of the general population, and it's different from just being like having a learning disability, for instance. So people who have a learning disability have difficulty with these academic skills, but not necessarily IQ, and they might not have, adaptive behavior kind of deficits either. So intellectual disability is both lower IQ and poor adaptive behaviors or life skills. And we're going to break these down into 4 different subsections. Now, I want to point out, though, these categories aren't hard cutoffs. So there's kind of a range of IQ scores that tend to fit in these different subsections, but it's more continuous. And also, I want you to kind of think about these labels as being transient. They're not permanent labels. So if someone has moderate intellectual disability at one stage, they can advance, they can get better, etc. Yeah, there's a lot that goes into these labels that's pretty stigmatized, and it should not be as defining as it comes across. That said, let's go into what these categories, these different groups tend to represent. So a mild case of intellectual disability, so this is closest to the higher end of that range, tends to be due to environmental factors, things like poverty, socioeconomic status being lower, things like that, so not having access to a lot of those good resources. And these individuals are pretty able to learn, to live independently. They can do their own thing. They can take care of themselves. They're functioning adults. So these are individuals who have very high capacity to still interact in society. Mild individuals tend to master up to a 6th grade curriculum, but it takes them a little bit longer to get there, typically around age 18 to do so. But many individuals in this group have normal jobs, normal marriages, families, etc. Now, individuals with moderate intellectual disability tends to be caused more by genetic factors or maybe medical conditions, things like chromosomal abnormalities in Down syndrome, for instance. And these have a little bit more moderate of deficits in ability. So they usually require some form of assisted living, some form of individual kind of helping them out. Kind of schooling wise, they tend to master about a 2nd grade curriculum, but not until around age 18 or so. Then we get into more severe intellectual disability, which is when individuals maybe only learn a few words or adaptive behaviors, things that maybe words to help communicate things like stop or hot or go or those types of words. And they tend to require some more assistance to function because they lack some of the communicative abilities and whatnot. And then profound intellectual disability are individuals who may learn still some basic self-care skills, being able to feed themselves, being able to wash their hands, for instance, but rely pretty heavily on other people to take care of themselves and function. These are hard labels to try to attach to someone. They're pretty stigmatized. One way to kind of, maybe a comparison to kind of make, severity of, one distinction you might kind of make is severity of depression. So maybe at some points you might have mild depression and be able to function, pretty normally in life, have a little bit of difficulty, but still be doing okay. It might kind of fluctuate. You might have some moderate and things might, you might require some more assistance at some points. You might kind of fluctuate throughout this scale. There's also not super hard cutoffs, as we mentioned earlier. So it's not like you have an IQ of 55 and you're considered moderate, and then you jump up to 56 and now you've mild. This is a continuum. It's not something that should be used to define someone or label their abilities or put them in a box or anything like that. We're not going to quiz you on these specific kind of numbers and whatnot, but I think knowing general abilities for these different categories would be useful. So I'm going to show you two different videos, and I think I'm going to just link them down below as MP4s. We'll see. But the first one is going to show you cases of mild and moderate intellectual disability, individuals who are going to college for the first time and they're stoked and they're telling you about their experiences. So this gives you kind of an insight into how these individuals function. And the other one I'm going to show you is an individual with severe intellectual disability. So they're able to learn pretty high priority words, and they rely pretty heavily on others to kind of help them interact with society. One thing you'll see what's pretty cool in this video is technology is super helpful in being able to help these individuals kind of lead a more independent and established life. So even though they may only be able to articulate certain short syllable words, they're able to still non-verbally communicate, for instance, using an iPad or drawings or pictures. So there's a lot of cool advances that are happening in this kind of domain. So watch these two videos to get kind of an idea of what this might look like, how these individuals might interact with society.